A number of institutions around the world now doing this procedure. It began in France by Daniel Dargent in Lyon. It then moved to Quebec in Canada, and now a number of centers around the United States do this operation, and we do it at the University of Michigan. The success rates are about 4% of women will recur. Now remember, I said when we do radical hysterectomies that it's about 96% cure rate. This is essentially identical. The chance of a patient dying of disease is low, and what this means is that even though some of them will recur, half of those who recur will still be able to be cured or saved by adding radiation. When they do fail, they tend to fail because of the size of the cancer, and this is why I was telling you it's so important that we not do this operation for big cancer. If the cancer is bigger than 2 centimeters, there is a 30% failure rate. That's unacceptably high. But if the cancer is small, the failure rate is very small. This operation works fairly well with pregnancies. About half of women who have a radical trachelectomy later decide to try and become pregnant. Now, the interesting fact of that number is that some women, even though they have done a radical trachelectomy, never choose to try to become pregnant. But in those who do, the conception rate is about 75%. The chance of losing pregnancy to spontaneous miscarriage in the first trimester of pregnancy is about the same as it would be for the population at large. In other words, this operation does not increase the first trimester loss rate. Second trimester losses are about twice what the population would expect who have not had this operation, but it's still a fairly low number. And in those women who then proceed into the third trimester of pregnancy, most will carry well into the pregnancy in the 35 to 37 week range, where they can be very successful in delivering a healthy baby. These operations or the deliveries are always by cesarean section, because we have placed that permanent cerclage stitch, so the cervix is no longer capable of dilating. Now, what about treatment for the advanced cancers? Here we have to use radiation, and the radiation is always accompanied with chemotherapy, usually with cisplatin. The combination of radiation plus chemotherapy has the best success rates. Unfortunately, patients who need this have a much lower success rate on survival. Patients with early stage disease are almost always cured. The stage 1 lesions with radical hysterectomy, it's about 90% cure rate, and if we can say after the operation that the lymph nodes are normal and that the margins of our resection are normal,